So a lab stewardship program is a part of the clinical quality journey. The first step is the support of that data that a lab stewardship program can offer. In clinical quality, data really helps to paint a picture or create a map for you. It helps you to understand what is happening at the work level. And so as you have that picture that is painted for you with the data, it helps the clinician to really define a journey that they're going to be on towards those improved outcomes. Another reason lab stewardship programs are so important is they support the clinician to do the right thing in an easy way. Within clinical quality, there's so many evidence-based guidelines, and honestly, there can be so many things for an individual to remember. And so a great lab stewardship program really can help the clinician and specifically offer those evidence-based guidelines in an easy-to-do way. One example of that is through utilizing the electronic health record when you have the order sets that clinicians will choose within that record. The evidence-based guidelines can be built into that order set. So having the order towards the top of the screen is just a simple action that can be done in order to help people to do the right thing. As a nurse, I'm at the bedside and my main focus is the patient that's right in front of me and delivering the medications that I need to or getting the labs that are ordered. But I might not necessarily think about how that connects with the individuals at the lab, making sure that things are done in a timely fashion. If I need to reach out to them to let them know about different circumstances or whatever.
Without laboratory stewardship, there is a potential that there is a lot of waste happening, and we might just not know it. Laboratory stewardship, one of the essential components is data analytics. So just the fact that you're looking at the problem, it'll probably identify many opportunities that we weren't even aware of that existed. For example, tests that are of questionable value and do not add much information, valuable information to the patient's record, just by eliminating those tests or replacing them with tests that are more informative, we can oftentimes reduce unnecessary testing, which is associated with significant costs. So for example, one of the tests that we eliminated from our test menu was a few $100s to the patient. But by recognizing that such a test is not really efficient for the patient, by eliminating that, we were able to save, even in the first year of implementing this program, we were able to save hundreds of thousands of dollars to the healthcare system and even more for our patients.
There are 4 essential elements to an effective lab stewardship program: governance, interventions, data, and the pipeline. Governance is the committee that you bring together to implement your lab stewardship program. They should be comprised of 3 kinds of people: influencers, informers, and doers. Interventions are what you're going to do to change the test ordering patterns in your health systems. They range from weak interventions like education or sending out memos to strong interventions like implementing a formulary or implementing hard stops in your EMR to prevent clinicians from ordering duplicate tests or tests that are better ordered in an outpatient environment. Data is critical to your lab stewardship effort. You already have data. You have data in your EMR and your LIS, and lab stewardship gives you an opportunity to bring that data together and analyze it to identify opportunities to optimize testing and reduce waste if it's present. The last element of effective lab stewardship is the pipeline. If you're working with a partner, they'll bring a playbook of ideas from their experience in other health systems. But the best opportunity for pipeline is with your own staff. They observe on a day-to-day basis where there are issues that could be addressed by the lab stewardship committee that would improve patient care and reduce the cost of care.